Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Diabetes mellitus, and you're looking at its types. So under diabetes mellitus, there is type 1, type 1 DM. So the type 1 diabetes is going to be the beta cell destruction. So type 1 diabetes is the beta cell destruction. So because of the beta cell destruction, it is usually leading to an absolute insulin deficiency. So there is an absolute insulin deficiency, and it can be immune mediated or it can be idiopathic. It is immune mediated and it is idiopathic. Now let's focus on the type 2 diabetes. So in terms of type 2 diabetes, it is insulin resistance. So type 1 is beta cell destruction. So there is destruction, and type 2 is insulin resistance. So type 2 is IR, insulin resistance, and this is with a relative insulin deficiency. There's a relative insulin deficiency. Now let's look at other types of diabetes. So other types of diabetes, it includes the genetic defects. So there's presence of the genetic defects. So under genetic defects, this is of a beta cell development or function. This is of beta cell development or the function. So under the beta cell development or the function, there is MODY. So under the MODY, it stands for the maturity onset diabetes of young. Next is there's a genetic defects in the insulin action. So genetic defects in the insulin action, it includes the type 1 insulin resistance, type A insulin resistance, then it includes the leprechaunism. So there is leprechaunism. Next is the Rabson-Mendenhall syndrome. So it is the Rabson-Mendenhall syndrome, lipodystrophy syndrome. Next, we move on to the diseases of the exocrine pancreas. So the exocrine pancreas. So this includes the pancreatitis, neoplasia. So this includes the pancreatitis, then the neoplasia. Next, the cystic fibrosis as well as the hemochromatosis. Then we look at the endocrinopathies. So what is present in the endocrinopathies? So under the endocrinopathies, there includes the presence of the acromegaly. So there's acromegaly, then there's Cushing syndrome. Next, there is also the glucagonoma, then the pheochromocytoma, as well as the hyperthyroidism. Next, we move on to the infections. So under the infections, there is a congenital rubella, then there is the cytomegalovirus, as well as the Coxsackie virus. Now, what are the uncommon forms of the immune-mediated diabetes? Uncommon forms, it includes the stiff person syndrome, as well as the anti-insulin receptor antibodies. So anti-insulin receptor antibodies. Next is we move on to the genetic syndrome sometimes associated with the diabetes. So this includes, there is the Wolfram syndrome. So there is Wolfram syndrome, as well as presence of the Down syndrome, Klinefelter syndrome, as well as the Turner syndrome. Now the last variety will be the gestational diabetes mellitus. To learn and grow daily like this, please do subscribe.